The World Bank president has joined many other critics calling the world's response to the current Ebola outbreak as disastrously inadequate. So far, more than 4,000 cases have been reported with more than 2,000 fatalities. Actual figures could be much higher. The WHO roadmap believes that the epidemic can be stopped within the next 6 to 9 months at an estimated cost of 490 million USD. However, the WHO concedes that more than 20,000 people could be infected and 13,500 dead before the epidemic is finally contained. After the financial collapse of 2008, the WHO budget has been slashed by at least 1 billion USD, leading to a 35% reduction of the agency's emergency response staff. The global budget for WHO is now less than 4 billion, significantly lower than the USD 6 billion budget of the US Center for Disease Control. The outbreak has also taken a huge toll on health workers in West Africa. More than 150 have died, including 5 co-authors of an important scientific paper on the Ebola virus. What is Ebola and why is it so deadly? And how is it spreading so rapidly? Ebola was discovered in 1976 during an outbreak in the Democratic Republic of Congo. It transmits through touch and body secretions.
Ebola infects specific cells of the immune system, cells that line blood vessels, and causes damage, and as a result delays or at least decreases immune responses and immune clearance and effectiveness, while causing breach in blood vessels and thereby causing bleeding.
Earlier outbreaks occurred in isolated communities, making the containment easier. This time, it's taking place in crowded localities and in countries that have weak public health systems. Developing a vaccine or a cure for Ebola raises the question of how the pharmaceutical industry looks at the diseases of the poor.
The epidemic that you see hides the fact that you have far more people in these countries, even today, dying of malaria, of tuberculosis, and other what are called neglected diseases. These diseases are called neglected diseases because while a large number of people die from them, people who die from them have little money to pay for their treatment, and that is why companies do not research drugs for this treatment. Ebola has been around for 40 years. We have known Ebola for 40 years. But why is it that you still do not have a vaccine or a drug to treat Ebola? Because it's not remunerative for pharmaceutical companies to produce drugs or vaccines for Ebola. So Ebola is really a symbol of devastated, crumbling public health systems. These health systems are crumbling today not because countries do not want functioning health systems, but because global economic and trade relations have made sure that countries do not have the money to invest in health systems, to invest and retain medical manpower. That is really the story of Ebola today.